everybody. In this lesson, we're going to be talking about a really common diagnosis for our infant and toddler patients. It's acute otitis media, which is an ear infection. Let's start by just doing a really quick recap on some basic anatomy of the ear. So you have the outer ear or the external ear, you have the middle ear, and then you have the internal ear. Now, you then, in between the middle ear and the internal ear, have this really important tube here called the eustachian tube. And the eustachian tube connects the middle of the ear to the back of the throat, which allows fluids to drain from the ear. And this allows the ear to equalize the pressure. And if this eustachian tube becomes blocked, then you can end up with fluid backing up in the middle ear. And that's what's happening with an ear infection. The eustachian tube gets blocked, which causes fluid to back up in the middle ear, which then leads to the inflammation and infection. Now, some kids are just prone to ear infections, and this is probably because their anatomy, they may just have a shorter or a more level eustachian tube that just naturally doesn't drain as easily, or they may have extra large adenoids down in the throat that actually are blocking the drainage. But there are actually some really important risk factors to be aware of for our pediatric patients that can actually make them more prone to getting ear infections. And the two most important things here are knowing that the way we feed babies can actually make them more prone to getting that fluid backing up. So if babies are laying more horizontally and bottles are being propped up, instead of holding them properly, you can actually get that drainage flowing back up into the ear. The second thing to be aware of is that kids who are exposed to secondhand smoke at home are much more likely to get ear infections than those who aren't. If you take a look in the ear of a child with an ear infection, you're likely going to see a bulging or inflamed eardrum or tympanic membrane like the one you see in the picture. Now, this can perforate or burst, which can lead to temporary hearing loss. If this happens, the eardrum will actually heal itself in a couple of weeks, but it can be pretty scary for families and for kids as well. Now, on the outside of the ear, the most common symptoms that you're going to see is pretty much a very unhappy child who's pulling or rubbing at their ear. They're probably going to have a fever, and ear infections also usually come alongside a cold, so they're probably going to have symptoms like a runny nose and a cough as well. Now, there are situations where you can have fluid building up really frequently in a kid's ear, and you end up with something called chronic otitis media. Now, these kids are not going to have those signs of inflammation. They may not even have pain, and they're not likely going to have those symptoms of a fever or cold. But what they will have is they can have hearing difficulty and speech delays because of those ear problems happening so frequently. So it's really important to be aware that if a child has hearing difficulty or speech delay, that someone needs to take a look in their ear and see if there's any signs of that chronic otitis media. The first step of management is really just to treat their discomfort. Like I said, it's really painful. So this means that we're teaching parents how to use medications like acetaminophen and ibuprofen, and warm compresses can actually help as well. Now, antibiotics used to be prescribed for every single ear infection. Like I said, it's uncomfortable for kids, and so we really wanted to treat it quickly. But as we know, we're becoming more and more aware of all these problems with drug-resistant bacteria, so we're much more careful about how often we prescribe antibiotics for ear infections. And again, we know that most of the time it's going to be caused by a virus. So most of the time now, if a child is 6 months or older, there's going to be this 72-hour waiting period where we actually wait to see if the ear infection will resolve on its own. And if it doesn't, then they can maybe be prescribed antibiotics if they're still symptomatic. But again, antibiotics, we're going to have a 72-hour waiting period if they are older than 6 months. If a child's having really frequent ear infections, those chronic symptoms that I mentioned before about hearing loss or speech delays, they may need a couple of procedures. So they may need something called a myringotomy. A myringotomy is where they put an incision to help drain the fluid from the ear, or they may need a tympanostomy. And a tympanostomy is when tubes or a grommet, like you see here in the photo, they're actually placed in the eustachian tube to help prevent it from getting blocked so that fluid can constantly drain through. And remember, we talked about how important it is to prevent these ear infections. So we're wanting parents to know about avoiding secondhand smoke, how important immunizations are, and then also to not prop those bottles up so that while they're feeding, the fluids can actually drain properly. Your priority nursing concepts for a pediatric patient who has acute otitis media are infection control, sensory perception. Remember, it can affect their hearing and their speech, and also their comfort. All right, let's go over your key points for this lesson. So first, just remember that otitis media is inflammation in the middle ear. And remember, this is because the eustachian tube that connects the middle ear down to the throat is blocked and fluids can't drain out. So fluids build up and the middle ear gets infected. Most kids are going to be complaining of pain and fever. They'll probably be pulling at that ear or rubbing it, and they may have cold symptoms as well. Most of the time, the cause is viral. So if the kid is 6 months or older, we're going to wait 72 hours before we would expect to see antibiotics prescribed, just in case it's going to resolve on its own. Now, if we see this issue happening chronically, and we see symptoms like hearing loss and speech delay, the kid may need surgical treatment. And that surgical treatment is going to help drain the ear and then also place tubes so that it will chronically and continually help that fluid drain out. Okay, you guys, that's it for our lesson on acute otitis media. Make sure you check out all the resources that we have attached to this lesson. Now go out and be your very best self today, and happy nursing.